The Health Minister has today announced millions of dollars for Pharmac to secure vital medicine amid fears of a global shortage. Not content with eliminating community transmission of COVID-19 in the country, Chris Hipkins says the $150 million spend over 2 years is due to the rising cost of medicines, with virus-related drugs costing around 70% more than they did before the pandemic. The Minister says the money is coming out of the COVID Response and Recovery Fund, and there's also extra cash for more ventilators and personal protective equipment. Mr Hipkins says he doesn't want to be caught out by another outbreak.
We're also investing more in our hospital infrastructure to support the use of ventilators in the event of an outbreak. We currently have 348 more ventilators on order, with delivery due by the end of the year. And we've got orders for more than 1,000 respiratory machines. 230 of those have already arrived. All of that life-saving equipment needs the right infrastructure to support it. So $35 million will be used to purchase more oxygen supplies and the necessary gear to ensure that oxygen is delivered at the right pressure. There's also more money for telehealth services, which continue to deal with high volumes of calls, and a further $50 million for PPE.
Today, there was just one new case of COVID-19, and that person is a woman in her 30s who arrived last week from London via Doha and is in quarantine in Auckland. There are 27 active cases in the country and none are in hospital. Director General of Health, Ashley Bloomfield, says the current situation is clearly due to the strict lockdown. And that's also why the general influenza rates are between 20 and 30% lower than usual. But he says he's concerned at the low level of testing currently in New Zealand, and fresh efforts will be made to provide free tests to anyone who visits a doctor with respiratory symptoms, including on weekends. Dr Bloomfield warned things could escalate, as happened in Melbourne, if people keep declining tests when they're offered.
If you are offered a swab, then please take up that offer. It is a fundamental part of our overall approach and strategy to getting ahead of COVID-19. We were all extremely conscious of and motivated by the situation Melbourne and Victoria now find themselves in. Small breaches there have led to extremely serious consequences, and the health system in Victoria, healthcare workers and the wider public are now at renewed risk. We obviously want to avoid that situation here, and testing remains a fundamental part of our overall response, and everybody has a role to play here.
And today, Melbourne has had its second worst day with 374 new cases and 3 deaths. With talk of a new vaccine coming out of Oxford University in the UK, the Minister admitted that New Zealand couldn't actually cope with a mass immunisation program, and it's time to start working on it now.
So we do have a national immunisation register at the moment. My understanding, the advice that I've received is that it wouldn't necessarily be able to cope with a mass immunisation program. So there's some IT work that is needed there around getting that register into a more robust form. It's a legacy system, so from time to time you do need to update these IT systems. So we're going to get on and do that work. That'll mean that we're well positioned when we're in a position to do a mass vax campaign, to use that as the platform to do that.
But despite the announcement of more funding for medicines, he couldn't be clear about where this country sits in the international pecking order to obtain the vaccine.
I wouldn't say that we're at the bottom of the list. Obviously, New Zealand's doing its part around, the international research effort to ensure that a vaccine is developed. Those decisions are a long way away at this point.
Dr Bloomfield says New Zealand hasn't paid anything for the Oxford vaccine, as it hasn't been fully proven yet, but the government is taking advice on a range of options. As for testing at the border, the Director General of Health says a program is now underway to test people working in managed isolation facilities. There remains no evidence of community transmission, and it has now been 81 days since a case of COVID-19 was acquired locally from an unknown source.